South Africa's seen no legal sale of cigarettes since the start of the national lockdown in March. Experts say the continued ban could be dangerous.
The government argues its decision is based on scientific proof and is in the best interest of South Africans.
The ban on the sale of tobacco products.
The ban on the sale of tobacco products.
The ban on the sale of tobacco products during the lockdown.
And all in the name of curbing the transmission of the coronavirus.
The lockdown of tobacco and the cost of lighting up. Welcome to the podcast. I'm your host, Razeen Gutta. In March 2020, South Africa imposed a tobacco ban as part of the country's response to curb the spread of COVID-19. The ban lasted for 5 months, from March to August last year. Despite being lifted for short spells in between, this was the longest standing ban on tobacco in any country as a result of the global pandemic. On this episode, we talk about behavioral changes, withdrawal symptoms, and why it's more difficult to stop smoking when you start at a young age. First up, let's get some first-hand insight on how the tobacco ban affected smokers. Wits education student Zinat Mohammed shares her experience.
I think the first thing that I experienced was anxiety, but I think everyone had anxiety because, COVID. I think I had cravings. A lot of cravings, like I started to binge eat and indulge in other things, because if you're so used to something for so long and then it gets taken away from you, it's hard to carry on normally without it.
Azim Ahmad has been smoking for 20 years now. Here he is sharing his experience.
It's stocked up based on how much I smoke a day for 2 weeks. And I thought, okay, I'm covered, And when lockdown ended, they had extended it. And I think I had like 1 pack left of cigarettes. And I was puzzling. I didn't know what to do. So I got a hold of a mate of mine who owns a petrol station. And I asked him, please, to sell me one or two boxes or even a carton of cigarettes to continue. And luckily, he could assist me with 1 carton. He said, look, I'm just going to do it for you because you're my mate or whatever the story is. And then that was that. Once that was done, and obviously now, we didn't know how long they're going to extend the cigarette ban, the smoking ban. So I had to cut down a lot on smoking. So I had to smoke much less than I would usually smoke. So normally I smoke about 20 cigarettes a day. I had to take it down to 10 cigarettes. And that on its own was very, very tough because I have certain moments where I smoke all the time. So it's either getting into the car, whenever I'm in the car, I light up a cigarette. It's when I wake up in the morning. It's after every meal, after every snack. So I got moments where I smoke my cigarettes. And obviously now when those moments came up, I had to just think twice about it. And it was very frustrating. I had terrible mood swings, and I literally tried to sleep a bit longer in the morning so I don't have to wake up, so I don't crave a cigarette. And I wasn't willing to pay those exorbitant black market prices, that carton that I got from him was getting less and less and less. So I had to cut down now from 20 to 10. Now I'm cutting down to 5 because now I'm rationing myself, and it became harder and harder and harder. In fact, my wife was trying to stay as far away from me as possible. My poor children bore the brunt of my mood swings. Yeah, so it wasn't a great experience not having smokes. So it's one of my guilty pleasures, which is obviously not good. It's not. I wouldn't advise smoking to anyone. But when you're so heavily addicted and you're so reliant on it, it becomes very difficult, and it's really addictive, and you depend a lot on it,
Absolutely. So after listening to those experiences, I feel this is a good time to bring in our expert. From the South African Medical Research Council, we've got specialist scientist Dr. Catherine Edgeby to give her thoughts on the importance of withdrawal symptoms and how much the age of onset matters. Let's have a listen.
I can tell you based on published papers and evidence that that are widely available. The earlier you start, the more difficult it is for you to quit at an older age. So withdrawal symptoms will not be because you are just withdrawal symptoms happen to everyone who use the who are addicted to nicotine. But some people can cope better than others. But what we've seen in studies conducted outside South Africa is that the earlier you start, the more difficult it is for you to quit. And maybe one could explain that biologically because nicotine affects the brain and the brain becomes so accustomed to it at an early age and somehow almost changes the pattern that the brain uses to get used to this addictive substance. So it's very possible that is the case, as they told you.
Well, there you have it. The earlier you start, the more difficult it becomes to stop. Withdrawal symptoms happen to everyone, all because nicotine affects the brain. Thank you so much to Dr. Edgeby for the insight, and thank you all for listening. This podcast episode is a part of the 2021 In-Depth Reporting Project, Year of the Student. The full project with articles and other multimedia can be viewed on witsvuvuzela.com. This is a project produced by the Honours in Journalism class at the Wits Centre for Journalism. Please see the show notes for full credits. That's all from me, Razeen Gutta. Cheers for now.